Dr. Garry Gordon. He's on the younger side as well, 76. Look at him, he doesn't walk like a 76-year-old. I don't think he's ready to go to the nursing home yet. Please welcome Dr. Garry Gordon.
Go to full screen? Yes. Thank you. Good morning, everyone. It's my great pleasure to be here, and I thank Dr. Ali and A4M Bangkok for this invitation to address you. At age 77, I've practiced medicine for 54 years, and you've just heard one of my patients give a fantastic overview that all of you need to know, because we will not reach our maximum intended useful lifespan unless we master the art of non-pharmacologic, non-surgical medicine so that my knees can work well because they weren't going to. My prostate was giving me all kinds of trouble. I was born with many, many health issues, and it is exciting to be standing in front of you at age 77 feeling the healthiest I have been in my life. Now, you might ask, well, what do you attribute? Because I had so many health problems. You might say, well, is it because you learned nutrition and you put all the good stuff in? Or is it because you learned how to get all the bad stuff out? It doesn't make any difference. You can't do it with any one single approach. You really need to have the passion, as I had since I was 11 years of age. I decided to become a physician. And I listened to every conference with mainstream and alternative medicine in every country because I was motivated to get out of my own health problems, which were pretty heavy. I couldn't, even in medical school, go up a flight of steps without getting into heart failure. Most of my life, I've had to urinate every single hour on the hour, day and night, because of an injury to my kidney when I was a child. I had total achlorhydria. I had the lowest level of magnesium seen in anyone. I had the highest level of mercury tested in the hair, blood, and urine. I became the director of a laboratory called Mineral Lab that later was purchased by Doctors Data. I've had offices in Amsterdam as well as Japan. I've lectured around the world on these things, but I, at this point, can tell you that these health problems that I suffered are gone. So it's fun to get to 77 years of age and have finally a healthy body. Now, these are some of the life-transforming things that I want to draw to your attention. Linus Pauling was my mentor, along with many others, and I fell in love with his story on vitamin C, but with my stomach, I couldn't take vitamin C, so it took 10 years to perfect a vitamin C that's now used by all the cancer clinics because it's well tolerated. Even if you are highly sensitive, everybody can take 10, 12, 15, 20 grams. I would never take less than 8 to 12 grams a day, but chelated minerals helped me immensely because you don't have enough magnesium if you're sick, and it isn't easily absorbed. IV chelation, on the 8th chelation, I was turned into Superman. It was unbelievable, but that's some 34 years ago now, and I really didn't know then anything about toxicology and how toxic everybody in this room is. You're all born with 1,000 times too much lead in your bones the day you're born, but you don't know how that affects you. My slides today, I hope, will educate you. So as the father of IV chelation, I wrote the protocol that 10 million people have been treated by, and we did get 29 million to study it. And I'll try to get through these subjects quite rapidly because we have a tight time frame. But I serve on the board of oxidative medicine, where I use ozone and ultraviolet blood and hyperbaric medicine for solid reasons. I lower the total body burden of pathogens, and I also start converting your toxins back to less toxic forms. And it's important to learn that maca and pararia, that you're going to have a separate lecture going on today by Dr. Schwartz, will astound you with what you can do with an alternative to bioidentical hormone therapy that's much more affordable and is better documented for its benefits on stopping bone loss and protecting the breasts and stopping things like cardiovascular disease. So you will have many things you're going to learn today. Zeolite has been used historically in India But now we had to have something to allow an astronaut to go to Mars with no water on the ship. He has to drink his own sweat and his own urine for the 2 years. So we have developed a zeolite that's beyond anything you have learned, and it's my answer to detoxing things that I cannot do with chelation alone. There's some brand new developments in diet, which we'll try to go into very rapidly, and I've concluded that everybody today, basically, we all knew death starts in the colon and the gut, and because we have so many things interfering with a healthy intestinal flora, I have everybody taking probiotics daily. And then this afternoon I'll be giving a talk about pulsed electromagnetic frequency. This therapy was the culmination of what I was missing. It was the missing link. The Earth's magnetic field has lost over 95% of its power. When it goes to zero, all of us are dead because no nutrition occurs if you're not in a magnetic field. That's why you would be dead should you choose to move to Mars. So my program, as my friend Burton Goldberg said, is multifactorial. I'm going to go through these rapidly. All of my slides are on my website, and we'll get to that rapidly. I would like you to have the chance to understand what I mean by fight for your health. Positive focus. Finding the foods you need to stop eating. That's complicated. Which food supplements do you need? What infection do you have? Harvard says 96% of you have cytomegalic virus. It's living in the plaque on your vessels. It has a lot to do with when you die, along with chlamydia. And cytomegalic virus is only one of the problems we face today, because today we have epidemics of things called Lyme and stealth infections. So there's a multifactorial approach, and the consummate physician is going to have to be able to help the patient prioritize, because it's expensive to fight a war on 6, 7 different fronts at the same time. All of you have phthalates and bisphenol A from the bottles we drink out of. These are very toxic. They have adverse effects, particularly on the estrogen receptor. But here in Bangkok, we have Pueraria mirifica that you're going to learn about, which is an SERM beta, selective estrogen receptor beta, and it actually displaces the bisphenol A, allowing the estrogen receptor to work. I, as a man, take it, but we stop the hot flashes, the vaginal dryness, the depression, the insomnia in women. But nothing is going to work without exercise. If you could put exercise in a capsule, it beats anything Big Pharma can deliver. But a lot of people don't feel the energy needed to exercise, as I clearly am enjoying. And they also have something that hurts, like a bad ankle or something. That's where PEMF and your knowledge of non-pharmacological medicine can be so beneficial. If I was to start my career over, having practiced medicine 54 years now, I would come in as Dr. Detox. I am somewhat known as the father of chelation. But that only gets at heavy metals, and it doesn't get the heavy metals out of your bones. So you need to learn that as good as IV chelation is, I've moved on to oral, along with the use of other substances that we'll cover, like the zeolite and fiber, high-dose C, because nothing, no one answer gets all the toxins out. And your bones will continue to release lead even if you've had 200 IV chelation, which I've had. But it didn't move any of the lead out of the bone. So if you stop the detoxification with aggressive treatment, you become totally poisoned again. Now, this is what's in every human in America. Neurotoxins, carcinogens, endocrine disruptors. These are the names. Everybody has been tested. No one's ever passed the test. It costs $4,900, so no one does this test. But if we do it, you fail. So it's these heavy metal exposures early in life that set the stage for you to be sick later in life. And it's very important to understand that epigenetics. And epigenetics give you a hint why the average sperm count today on the planet is down to 40 million when it used to be 140 million. What happened to the other 100 million sperm? Well, it's tied directly to the toxins that we all have, but since there wasn't any easy answer, nobody talks about them. So whether you get into methylation and methylsulfonomethane, trimethylglycine, and use the methyl form of folic acid, sublingual form of methyl B12, I really am into methylation. As Dr. Grossman's patient, Ray Kurzweil, has done a good study that methylation is a major component to aging in that it becomes defective and slows over aging. So the epigenetics of aging is a really important topic, and I do these things with methylation support. I don't give anybody vitamin C without giving them MSM and trimethylglycine, and I give everybody methyl form of B12 and the methyl form of folic acid. That's the expensive one. The other one doesn't really work as you plan to live to 100 plus, and we all can live well over 100. This is the slide out of Harvard Medical School, published in the Journal of the AMA, but none of my colleagues seem to want to read it. It tells you that your bone is where the lead is when you're born. It is downloaded from the mother's body, as Dr. Burton Goldberg was saying. And that lead in your bones is slowly reaching equilibrium with your other tissues. So you can take IV chelation and your heart gets much better. I was on the 8th chelation. I could run up a hill. Turned into Superman. I thought I was cleaning arteries. It wasn't that at all. It was that low-level lead sets the stage for heart disease, not just cataracts, as this slide discusses. But you need to know that doing a hair test and a blood test, we have to remain scientific. We have to motivate our patients to take care of themselves, and that's the reason we have a study in Tokyo, 10,000 patients, 10 years, that was paid for by the Sun Moon Church. None of them died of cancer, even if everybody in their family died of cancer. I'm an expert at how lifestyle and diet can offset bad genes. Never tell somebody to take their breasts off and their ovaries out because they're BRCA1, BRCA2. That is bad medicine from uninformed people who don't study as I do. You need to know that men with high levels of bone lead are 6 times more likely to die of heart disease. So you have to become a toxicologist. You have to learn the detoxification. I thought I was a roto-rooter. I was cleaning plugged arteries like a Drano. That was not exactly what was happening. Some people did unplug arteries that looked badly plugged with IV chelation, but that's not the mechanism, which is why I'm now able to move all of you into 3 or 5 minute short, painless chelation with calcium EDTA and do more for the patients of this country and the world than the 2 or 3 hour chelation does, unless you're specifically dealing with calcific valve disease, in which case lowering the level of ionizable calcium with the slow chelation is warranted. The rest of the time, we're wasting the patient's time and money because the short chelation is quicker, better, and we combine it with a Myers. The patient pays the same thing, but the patient lives far longer because they can do this once a month, but they have to be on oral detox every day. So this article from Organized Medicine tells you that all causes of morbidity and mortality are tied to how low the level is in your body of lead. And that ties all the way to cancer, that ties to heart disease, every cause of morbidity. So if you could keep your lead level at 0, but you can't, because every time you breathe, you're taking in more lead and mercury and cadmium because we burn coal to turn on the lights. And China is turning on a lot of coal burning. So we need to get really straight that detoxification is a lifetime challenge. And you need to know that the lead in your bone is going to take years of continuous treatment, and I use zeolite, high-dose C, I use fiber, I use the stabilizer, I use lots of things. But the Harvard studies make it very clear that bone lead is not moved by taking IV chelation. So if we get the picture then, this is what I take as supplements. Very few people take anything like this. This is expensive, but I had to rebuild my body. I wanted to enjoy good health because I'm going to live well over 100. I might as well earn the right to have health. But if you look at this list, there's nothing on here that if you were 77, you wouldn't probably want to take. But I'm taking the hormones, the amino acids, the fatty acids. It's expensive, but it's life-changing. So if I can make this point very clear, we want to have, we want to have the really understanding that I was lucky enough to be trained by the greats. Roger Williams, Linus Pauling, Abraham Hoffer, Will Shute, Emanuel Shraskin. These are people that I reacted with directly, one-to-one. These are the people who changed my life when I was as dumb as the next one and I was prescribing drugs. I was very famous at the hospital. I had a huge level of patients in the hospital at all times. I was one of their favorite guys until I met all these people. And the net result is I wound up, instead of having 8 patients in the hospital every single day, I wouldn't put 8 patients in the hospital in a year. John Miller was my mentor on chelated minerals. John was head of research for Oregon Pfizer. He was the first guy to put minerals into a vitamin. He was the first guy to chelate them. He was the head of Chem Abstracts. He was an authority on all the published research. Bruce Ames is still alive. I know him well. He's a Caltech graduate, one of the world's authority on biochemistry. Carl Folkers Reardon is one of the first guys to really learn how to treat cancer effectively with vitamin C, doing all the things you have to do, because vitamin C alone is wonderful, but it's not the answer alone. And nobody should be receiving IV chelation without the ideal, best absorbed oral form taken every day the rest of their life, like Linus Pauling said when he wrote the book. Mildred Seelig was the head of the American College of Nutrition. She's a world authority on magnesium. Chelation and cardiovascular disease, I've written this article. All of these slides are on my website. The book Vulnerable Plaque by Fuster, who was the head of the American Heart Association, and he's the head of cardiology at one of the leading medical centers in New York City, he states that cholesterol is not the problem. Aspirin does very little. It is not truly an anticoagulant, just an antiplatelet. So I don't waste time. I take all patients off Coumadin, and I've had no patient die of a heart attack. In over 20 years, I cancel stenting and bypass on my patients routinely, even if the vessel is 98% closed. But I can do that because I have the experience to back it up. I've been on the medical board for alternative medicine, homeopathy in Arizona, so I know what I'm doing, and I can teach all of you what we're doing, and I make it affordable. We have a free school on my website called FACT. 3,500 doctors can go there at no cost. The last slide will hopefully bring you there. And you can put in the word autism or breast cancer or prostate cancer and learn how easy it is to treat prostate cancer in most cases. If you understand this simple thing, Dr. Morrison spent $10 million, wrote 3 books, and it was all about how to stop all heart attacks by stopping fatal blood clots, never attacking the cholesterol. Cholesterol is not the issue. It's money-making. These 3 books are what have empowered me to cancel bypass on all patients. So the trial to assess chelation, when after they couldn't lock me up in jail because I wouldn't shut up, we've treated 10 million people successfully with chelation. They gave us 29 million to study chelation. The study is now completed. The results will be released later this year. So it's hard to stop me because I'm passionate, because I know what I'm doing. And chelation is many things. Garlic's a chelator, vitamin C is a chelator. But rats alone increase their lifespan 50% when you treat them with EDTA. And the reason I'm so passionate about EDTA, I put it in everything I do. My fiber has EDTA in it. I bathe in EDTA. EDTA extends the lifespan of multicellular organism a minimum of 50%. How come? It's kind of interesting. So the calcium EDTA, the short chelation is what I teach. That's why 3,500 doctors are no longer having patients sitting around with an aching arm for 3 hours, losing income, when I can get a better result in 5 minutes with this protocol. And I repeat, these slides are on my website. Every talk I give is on my website. Every talk is downloadable. You simply email me if you want the slides to use for your patients. Now, chelation is under attack again. And ACAM realizes the time has come, because although I wrote the protocol, and it took me a year, some 34 years ago, to write the protocol to treat 10 million people without a single recorded death in anybody following my old protocol, the time has come to do a new one. And instead of talking about cleaning arteries, to focus on detoxing the body. So you can do that with vitamin C. These books are life-changing. If you really bought these books, 1,200 references here tell you there isn't a condition that your patient isn't going to be helped by if you used enough vitamin C. And of course, it helps if you can get it well absorbed without upsetting the stomach, and obviously IV is a great way. But we want everybody to know that vitamin C levels are always reducing the risk of mortality from any disease. So you want to do as Linus Pauling did. That was my mentor. And so I've never been on less than 12,000 milligrams once I could solve the problem that it wasn't tearing up my guts because I have no stomach acid. So vitamin C is a Trojan horse for the treatment of cancer. There isn't any cancer that you can't clearly show benefit when you use vitamin C, but you need to understand how it's working. It converts into hydrogen peroxide inside of the cell, but the hydrogen peroxide is not detoxed in the cancer cell because of lack of catalase. So there's a reason that we like these things. All of these things are chelators: malic acid, MSM, betaine. All of these things have benefits. I take alpha. Everything I'm showing you, barley, green, cilantro, I take every one of these things every day. In Japan, we have a company that does a lot of work with garlic. They have documented studies that it actually reverses coronary heart disease at USC. And I use the red yeast, right? I use all of these things. The carrageenan, we found with the $10 million that Dr. Morrison spent with those 3 textbooks I showed you 3 slides ago, that works in your body with a special form of carrageenan as though it's a shot of heparin, as long as you have the EDTA with it. That's why I've been able to cancel bypass surgery on all my patients. Zeolite is used widely in India, but not for the purposes of this book. This is a $250, 1,200-page textbook by the American Chemical Society explaining to you how zeolite is the ideal filter to take out heavy metals and many other things, and it has antimicrobial effects. This is a picture of what it can do if you just bathe in the EDTA. We treated this one hand, and in 2 weeks that one hand got much younger than the other because zeolite's pretty amazing. And I said that there's a great idea of how avoiding sugar can make everybody live longer. This book I recommend for everybody, Blood Sugar Solution by Mark Hyman. It will help you change the life of millions of patients. And ex-President Clinton says that this diet, which has caused him to come from near death back to life, could help save the world economy. I hope I make my point. Please go to Amazon, buy this book. You will be astonished. Everything that I would like to teach you, and I have worked very hard to learn what I do. I've practiced medicine 54 years, and I never stopped going to meetings, but so much is in this book that you won't have to work as hard as I had to understand how all this works. Toxins are helping keep us obese. We get genetically modified food that makes us get leaky gut, that makes us wind up with food sensitivities. We know that we have to treat the entire immune system is the gut. So I have everybody on a power drink, which has got the organic, green, stabilized rice, my special vitamin C, and we put in that the thing called maca and the zeolite. Maca is a big story. You add that to the Pueraria mirifica, which I call herbal remedy from Thailand, HRT, and women at 75 years of age become extremely sexually active, even though the vagina for 10 years was so thin and so painful that sexual intercourse was impossible. This we do today without bioidentical, without compounding pharmacies, all on my website. Suzanne Summers is my buddy. She is this one that brought the attention of the bioidentical hormones to, and her new book has 24 pages in it of my program, of my FIGHT program. I take every day every hormone. I'm on DHEA. I found an alternative to growth hormone shots in which I use things like Tribulus in Mumio, which absolutely has me still with excellent muscle strength at age 77. And that's important. At age 90 and 100, you want to be able to open the doors. Now, they say that the monkey study looked like it didn't support the idea of caloric restriction as anti-aging, but we all eat too many calories and there was far less diabetes. There are benefits. Your future is going to be if we start getting more into the telomere and telomerase and using that. This is a dramatic study of what is possible. This is a study from Harvard, November 2010. You must have missed this one. This mouse was near death. This is a study in premature aging in mice. And we used a estrogen-related, because estrogen is the growth factor. That's where growth occurs. That's why I'm so afraid of estrogen until you come to Thailand and learn what Pueraria mirifica can do. It does everything that estrogen want to do, and amazingly enough, we had total regeneration of the kidneys, the spleen, the adrenal gland. So pruriria is a great story. There's a lecture being given later at this meeting, so we won't spend any more time on it. I just want to make sure that you understand that maca is also able to totally normalize LH and FSH in women totally safely. It does increasing the mounting of rodents between 3 and 6 times, so it does have sexual stimulation, and it's good for anti-aging that we remain sexually active. So maca is also a glucosinolate, so it actually helps deal with lead. So it's part of my power drink when I use the stabilized rice bran, and I use the green, and I have the vitamin C. So my power drink is to have something in my intestine at all times that protects me against the poisoned water, food, and air that we're all getting. You're going to learn this term. I'll be covering it later in my second lecture today at 4:30. Bioporation means that when I use this special magnet, I can have the cell membrane open up and magnesium and other nutrients flow in. It gives the cell the energy. This is a mouse. That's a joke. This mouse is to remind you that magnetically induced cell exercise is the one thing that you're going to learn at this conference, and we will make sure that you get a chance to see why I'm so excited, because it is part of the new physics. This book, Michio Kaku, Physics of the Future, is $15. If you buy it, he talks to 20 Nobel Prize winners, and he tells you why every one of you in this room are going to live to well over 100, things that you have no idea are in the offing. This is an incredible slide. We have a Center for Regenerative Medicine at the University of Pittsburgh, where we've recently regrown an entire quadricep on a boy whose leg was blown off in Afghanistan. And we've obviously regrow a finger. This is cryptines or cryptic peptides. These are very exciting things that bring out a massive stem cell response in your own body without even having to buy stem cells. I like stem cells. They're going to be fantastic. But if I can have my body healthy, then I will get a far bigger bang. And with this substance, I'm telling you, your own body can do things. But the future is to learn the physics. And so we all know about Qi, Life Force. These 2 textbooks cost you $54 on Amazon. They will give you 1,200 references, and they'll make you an authority on what happened several weeks ago. The new physics was confirmed. The Higgs boson, God's particle, was proven, and magnetism is the Earth has lost most of its magnetic field. You can do it and find devices and sleep on magnets and find devices that will restore the magnetic field, give you the bioporation, help the cells have the energy to push the toxins out. We need far infrared saunas. We can sleep on pads. It's been my great pleasure to be with you today, and I thank you for your attention. Thank you. And the fact is where you go to join my 3,500 doctors who talk to each other by email. So my website has this special school that is free of charge to all of you, so you know our protocol for short chelation, our treatment for autism, etc. And I do a lot of gene testing today to show people why they're so toxic, because many of our genes that are supposed to help us handle toxins have been absolutely missing or downregulated due to the substances in our environment. Again, thank you for your attention today.
Thank you for that incredible lecture and for respecting the clock.